You are watching the Doc Talk Show.
Welcome back to the Doc Talk Show, a show that is brought to you by the National Medical Stores and Cameroon Men's Collection. If you have not invited your friend, if you have not invited your family, if you have not even invited your frenemies, kindly do so, because we are having a very, very wonderful discussion this evening. Thank you so much, Andrew, for what you're doing in the community, trying to make the Sustainable Development Goal 3, which is about health and well-being, a reality. You are basically bringing effective and quality and affordable medical solutions right there in the community. And I am so thrilled because you are basically a change maker in a country like Uganda, where we have a very high mortality of about 6.2 for 1,000. We really need every hand on deck. Yeah, we need all the systems to be working, the health workers on board, the VHTs on board. And what you're doing, your community approach to prevention and treatment of disease is so crucial. However, our viewers are interested in knowing, where are you doing this work? Yeah, because in my community, you're not there. My father still has to travel from Chai to come to Kampala for medicine. So you're not yet in Gomba, yeah?
Yes, I'm not yet there.
Yes, so we want to know, where are you based, yeah? What are some of the technologies, yeah, that you're utilizing to actually prevent and treat diseases? Yeah.
Before I tell you where I'm working from,
Yeah.
there is a saying that goes, pick the low-lying fruits first. So this whole thing, we start with what is there.
Yeah.
Okay, so I'm based in Manafa district. That is where I come from.
Yeah.
But I have also extended my services to some people in Mbale.
Yes.
And then also Mayuge district. So I've reached some people that side. So like I said, pick the low-lying fruit first.
Yeah.
So more like the things that I'm using, I'm using things that are available,
Already existing
locally
structures,
available
yes.
resources,
Yeah.
majorly, because the community is there. Those are some of the requirements. Of course, the people are already there.
Yeah.
So I'm using them to better their own lives.
Yeah.
And then I'm adding some few things. The technologies that we use, even if they are manufactured from out, some of them or most of them are still locally available.
Yes. So what are some of those things that you're using? Do you have like a mobile van that you go with into the community? Do you have equipment for testing blood? What exactly do you employ in your community approach to disease prevention and treatment?
Yeah, when I started on foot.
Yeah.
I could move on foot.
Wow.
And then majorly during COVID-19, because people were not allowed to be carried on the motorcycles, and they were home, and some needed to go to the hospital.
Yes.
So I needed to identify people, so I used to move and then see them from home.
Yeah.
After some time, I started using a motorcycle when they allowed health workers to move.
Wow.
So I could use a motorcycle with my friend, and then we move.
Yes.
And check on those patients from their homes, help them, those ones who needed medicine.
Yeah.
We could still go for them in the hospital and get for them, most especially those ones with hypertension, HIV,
diabetes,
and, yes, diabetes,
sickle cell,
all of those ones.
Yeah.
We needed to link them to the health facility. So as the country was shut down, we were busy making sure that we reach our patients who
and
are
saving
in the community
them,
and
yes.
save them.
Yeah.
So after some time, people started getting interested in the work that we were doing, and we were able to acquire the vehicle.
Yeah.
That now we use to move to other places. That's why now I was able to reach Mbale and Mayuge after getting the vehicle. But of course, as you say, that your father's in where?
In Chai.
Chai. One time we shall reach that area, because now we can be able to move. So right now we have the vehicle, but the things that we use, I started with the blood pressure machine and the glucometer.
Yeah.
I was just having those two. and I used to move and like check on people, tell them how they are standing, and then advise them, those ones who needed to see the medical officer or any medical help, I could link them.
So you actually also do referrals for the cases you've identified in the community.
But I was not working alone because I could work with the LC1 and then the VHTs.
Yes, the
so
village
I mobilized
health
the village health team who are there. So I was working with them as well. So we were able to do that. But with the time, when I kept on getting some more resources in terms of finance, I could not just continue with only my glucometer and blood pressure. I had now to go ahead and train the VHTs. So like a sub-county where I started from had around 5 parishes. I divided them, and each parish I assigned a VHT leader. I called the community in each parish. I taught them about hypertension, diabetes mellitus, and then I taught them how to use the blood pressure machines themselves. And then by the time I left, the VHTs were able to measure the blood pressure and then the blood sugar and note in the book. And I gave them charts that showed the normal, moderate, and severe. And they were able to know when they have measured that now this is high, this person needs to go to the health facility. So what I did, I actually bought for them blood pressure machines and glucometers. And as I talk, those people now measure people's blood pressure for free. And then they also measure their blood sugar. And I have also gotten for them some small phones for 35 each leader. So they keep communicating with me. They tell me in case they find out someone who has maybe elevated blood pressure, they inform me, and then we direct that person. Since we started doing that, we've been able to identify about 10 people who didn't know that they actually had blood pressure.
That is nice.
Actually, who didn't know that they actually had high blood pressure, because all of us have blood pressure.
True.
Sorry for that. So those people have been linked to the health facilities, and at this time they are receiving treatment. Which
is very, very important, because when we are able to identify disease before it is severe, there are higher chances of controlling the disease, but most significantly, we are able to prevent mortality, but also morbidities that result from complications. For people who have high blood pressure, they can get a stroke, you know, they can get lower limb gangrene, you know, the people who are diabetic, they can get very bad soft tissue infections. And in the hospital where I work, we have so many people who are in community and they have been there for a very long time with uncontrolled diabetes mellitus. They come in with gangrene and diabetic feet, and before you know it, they're actually getting an amputation. Yet all these things would have been prevented if they had they were being followed up and their sugars were actually controlled. So what you're doing is very, very, very phenomenal. And I like the fact that you're not working alone. You are empowering people not only with knowledge, but also equipping them with the skills to be able to utilize equipment that can inform a decision that, you know what, for you, you can just continue taking your medicine, or you need to change some lifestyle, or you need to now start exercising and eat better, or you actually need to be referred to a health unit. So that is really, really wonderful.
Yeah, actually, doctor, most of those things, they're not very expensive, but yet they yield a lot of results. Because it doesn't take much to inform a mother about the importance of antenatal care, but when you inform them, you will find that the deaths will reduce, because then when they attend all the antenatal cares, they will be advised and they will end up producing from the hospital.
And health
also
babies.
Those things of cord care, they look to be very small, but when you do them, actually they yield a lot of results, and we started already seeing the results. So we don't need to do much, we just need to do that little at the time, and you know, there is a way God works and things work out. I'm really excited. We are going to take a short break and we'll be back
However, before we leave, I would like to thank our sponsors for the Doc Talk Show, the National Medical Stores who distribute medicines and medical supplies across the nation, and also Campbell Men's Collection, who provide you with wonderful men's stuff at the right prices.
You are watching the Doc Talk Show.